You just got your blood test results back. And right there, in black and white, it says your PSA is elevated. Maybe it's 5, maybe it's 8, maybe it's 12, and your brain immediately goes to the worst place possible. Do I have cancer? Before you spiral, I need you to take a breath. Because a high PSA number does not automatically mean cancer. And in this video, I'm going to walk you through exactly what that number means, what causes it to rise, and what you should do next. Step by step, in plain English. No medical jargon. No panic. Just clarity. Welcome to Prostate Clarity. I'm here to help you understand exactly what's happening, so you can have a real, informed conversation with your doctor. Here's what we're going to cover today. First, what PSA actually is and where it comes from.
Is a protein made by prostate cells.
Second, what numbers are considered normal and how age changes everything.
Everything looks healthy.
Third, the three most common reasons PSA goes up, and only one of them is cancer.
Especially this third one right here.
Why one PSA number tells you almost nothing on its own, and what matters far more than the number itself.
Throughout the period.
What your doctor will likely recommend as your next step, like an MRI.
We'll walk you through exactly what to expect during the scan.
And finally,
here are
the exact questions you should be asking at your next
before
appointment.
Making a decision.
By the end of this video, you'll understand your PSA result better than most men who've had the test for years. Let's get into it. Let's start at the beginning. PSA stands for Prostate-Specific Antigen. Antigen sounds scary, but it just means protein. PSA is a protein produced by the prostate gland, a small, walnut-sized gland that sits just below your bladder. The prostate's job is to produce fluid that nourishes and transports sperm. PSA helps keep that fluid in liquid form. It's a completely normal protein. Every man with a prostate makes it. Now, a small amount of PSA leaks into the bloodstream. That's what we measure with a PSA blood test. When we see higher levels of PSA in the blood, that tells us something is happening in the prostate. But, and this is critical, it does not tell us what is happening. That's where most men get confused. A PSA test tells you that something is going on.
Versus what?
It does not tell you what. Let that sink in for a moment. Think of it like a smoke detector. If it goes off, it means something in the house needs your attention. But it could be burnt toast, which is annoying but harmless. Or it could be an actual fire. You still need to investigate. And that's exactly what we're going to help you do. So what's a normal PSA level? The traditional cutoff is 4.0. If you're below 4, most doctors call that normal. But normal PSA changes with age. Men in their 40s, typically below 2.5. Men in their 50s, below 3.5. Men in their 60s, below 4.5. And men in their 70s, below 6.5.
in the 70s.
Why does this matter? Because a PSA of 4.2 in a 45-year-old man is actually quite concerning. But a PSA of 4.2 in a 72-year-old man, that might be perfectly within the expected range for his age. This is why you can't just Google your PSA number and panic. Context is everything. Your PSA number needs to be interpreted by a doctor who knows your age, your history, and your baseline. When your PSA is high, there are three main reasons, and only one of them is prostate cancer. Reason number one, benign prostatic hyperplasia, or BPH. Don't let the name scare you. It's just fancy talk for an enlarged prostate. As men get older, the prostate naturally grows bigger. That extra tissue produces more PSA, even if it's completely non-cancerous. BPH affects more than 50% of men over 60 and over 90% of men over 80. It is incredibly common. Symptoms include needing to urinate more frequently, especially at night, or feeling like your bladder never fully empties. Reason number two, prostatitis. This means your prostate is inflamed, usually due to a bacterial infection or irritation. When the prostate is inflamed, it leaks a lot more PSA into the bloodstream. PSA levels can spike dramatically. In some cases of prostatitis, your PSA can spike to 20, 30, even 50 or higher. It looks terrifying on paper. The good news, treating the inflammation usually brings PSA back down. Your doctor may retest you in 6 to 8 weeks. Reason number 3, prostate cancer. It's important to understand that this is often the least common reason for a mildly elevated PSA. Even when it is present, most cases are slow-growing. Many men live for decades without it ever becoming life-threatening. There are also temporary factors, things like recent sexual activity or vigorous exercise like cycling. Even a urinary tract infection or a recent prostate exam can push that number up temporarily.
UTI. Are you sure this cup is mine?
To summarize, 3 causes: enlarged prostate, inflammation, cancer, and the first 2 are far more common than the third. Understanding these possibilities is the first step to turning off the panic button. Now, let's talk about trends. Here's something your doctor may not have time to fully explain. A single PSA number means very little on its own. What matters far more is the trend. Doctors use 2 key concepts to track this: velocity and doubling time.
The trend.
PSA velocity is how fast your PSA is rising over time. Think of it like a speed limit for your prostate. An increase of more than 0.75 per year is considered a red flag, even if your absolute number is still normal. Then there's PSA doubling time, literally how long it takes for your PSA number to double. A doubling time of less than 3 years is concerning, but longer than 10 years, that is generally very reassuring. Think about it this way. A PSA of 5 that has been stable for 5 years is very different from a PSA that was 2.5 last year and is now 5. Same number, completely different story. One elevated PSA is a flag. A pattern of rising PSA is a signal that requires action. PSA density is another useful concept. It compares your PSA level to the actual size of your prostate. A larger prostate is expected to produce more PSA, so a PSA of 4 in a man with a small prostate might actually be more concerning than a PSA of 6 in a man with a very large prostate. Your urologist can calculate this using an MRI or ultrasound to measure prostate volume. It adds important context. It adds context that a blood test alone just can't give you. Now, let's look at the roadmap for what's next.
Beyond the blood test.
Okay, so your PSA is elevated. What happens next? Let's follow the typical pathway. Step 1. Repeat the PSA test. The first thing most urologists do is repeat the test in 6 to 8 weeks. Why? Because PSA can fluctuate. A temporary spike from exercise or stress can normalize on its own. A repeat test rules out a false alarm. It saves you from unnecessary worry and further procedures. Step 2. Prostate MRI. If your PSA remains elevated, the next step is often a multiparametric MRI or MP-MRI. This is a detailed imaging scan that can identify suspicious areas without any needles or cutting. The results come back as a PI-RAD score, ranging from 1 to 5. Think of it as a suspicion scale.
Indeterminate or unclear.
PI-RADS 1 or 2 means nothing suspicious was seen. It's the result most men are hoping for.
The correlating results right here.
PI-RADS 4 or 5 means there is a concerning area that warrants closer attention.
This shows steady improvement over the last quarter.
Step 3. Biopsy, but only if needed. A biopsy is not automatically required just because your PSA is elevated. The evidence now strongly supports using MRI first. It helps identify who actually needs a biopsy and who doesn't.
First,
bottom line, elevated PSA to repeat test, to MRI, to biopsy only if indicated. That's your roadmap. Before I wrap up, I want to leave you with the exact questions you should bring to your next appointment. Question 1. What is my PSA trend over time? Not just today's number.
PSA trend?
Question 2. What is my PSA density based on my prostate size? And question 3, should I get an MRI before even considering a biopsy?
It's an important question to ask your doctor.
Question 4, could BPH or prostatitis be causing this elevation based on my symptoms? And 5, how quickly does this need to be addressed, or can we watch it for a few months? These questions will immediately signal to your doctor that you understand your situation, and you'll get better guidance.
And monitor it closely for the next 2 weeks.
Knowledge is not panic. Knowledge is power, and you now have more of it. To recap, a high PSA does not mean cancer. It means your body is sending a signal that deserves attention.
High PSA is not cancer.
The 3 most common causes are an enlarged prostate, inflammation, and prostate cancer.
We'll start by examining BPH.
What matters is the trend, not a single number. And the next step is almost always a repeat test. If this helped you, hit the subscribe button. We publish simple, clear explanations of everything to do with prostate health. And drop your question in the comments below. I read every single one. I'll see you in the next video. Always remember to consult with your own medical professional. This video is for educational clarity. See you next time. Stay informed, stay healthy. Thanks for watching. Your health journey is just beginning. Check out these other videos to learn more about the next steps in your care.
Perfectly. Let's compare the results.
Peace out. See you in the comments. Now that you have the medical roadmap, let's talk about what you can control. Lifestyle plays a huge role in prostate health.
Exercise.
First, nutrition. Studies from Harvard show that lycopene, found in cooked tomatoes, may help protect prostate cells. Pro tip: your body absorbs lycopene much better when the tomatoes are cooked or processed into sauce. On the flip side, reducing red meat and high-fat dairy has been linked to better long-term prostate health.
And should be avoided in your diet.
Then there's exercise. Men who engage in vigorous walking for 3 hours a week have shown lower risks of progression. Weight management is key. Excess body fat can influence inflammation and hormones that affect the prostate. Chronic stress isn't just in your head. It triggers inflammation throughout your body, including your prostate. Simple stress management, like deep breathing or meditation, can help lower your overall inflammatory markers. And don't forget pelvic floor health. Keeping these muscles toned can help with some of the BPH symptoms we mentioned. Lifestyle isn't a replacement for medical care, but it is a critical piece of the puzzle.
Completes our overall well-being puzzle.
When you combine these habits with regular testing, you're not just watching your PSA, you're active in your health. The goal is long-term stability. Small changes today can lead to much better results tomorrow. In our final section, we'll wrap everything up so you can walk into your next appointment with total confidence.
This is the final summary of our research.
You've got this. PSA is a tool, not a sentence. Use it to your advantage. Let's head into the home stretch. One last look at the entire journey.
The finale.
Let's take one last look at the journey we've been on, from that first moment of panic to having a solid plan.
All the difference.
Remember, a high PSA is not a diagnosis. It's a signal to investigate, not a reason to despair.
First,
BPH and inflammation are far more common than cancer,
an ice pack can help.
Cancer is often slow-moving.
And remember to take things slowly, like the snail.
One number is just a snapshot. Your trend over time is the real story your doctor needs to see.
Trends are greater than the numbers themselves.
Modern medicine gives us tools like MRI to get clarity before we ever talk about needles. You're not just doing this for you. You're staying healthy for the people who love you.
Look
how happy he is with the broccoli.
You're not
I
alone
need
in
everyone's
this.
attention
Thousands of
regarding the
men
new
are
procedures.
asking these same
Please
questions
silence
right
your
now
side
in our
conversations
comments.
and listen closely.
So, take that breath, ask those questions, and take charge of your prostate health today. I'm so glad we could go through this together. I'll see you in the comments below. Congratulations. You are now much better informed about your PSA results. Check out the links in the description for our sources and more resources on prostate MRI and BPH. Because when patient and doctor work together as partners, that's when the best outcomes happen. Prostate Clarity, bringing you peace of mind through science. See you next time.